Hi guys, this is Jacqui Cooper with Jcoopertravels, but also today we are on Cooper Virtual Career Day, and I have a very special person here talking with you. Eliecia is on. She is talented in many ways. She is both an entrepreneur and she has started her own business, but today I'm asking her to speak specifically to her traditional job because the purpose of this podcast is for elementary, middle, and high school students to learn about various career options. Now, we also have the YouTube side, so if you are watching, you are able to see us. But for those that are not watching, Eliecia, thank you so much for being here. Can you share with those that are listening what you do during your traditional day?
Hi, thank you for having me. I am a ophthalmic technician. I'm a COA. I'm a certified ophthalmic assistant is what the COA stands for. But basically what I do is I assist an ophthalmologist. I help him or her take care of a patient with their eye needs. I refract, meaning that I help make the prescription for glasses for the patient. I put in the dilating drops. I check their eye pressure for glaucoma, take a detailed history. I tell my patients that I'm the mean one that make them cry. I put drops in their eyes. I'm also the nosy one. I find out details about your medical history and your eye history so that the doctor can take all of the information that I give him or her and figure out what's going on with your eyes, or just say that you're healthy and happy. We have a lot of detailed equipment that is very specialized and a lot of different applications. And fortunately, we are able to diagnose certain things, cancers and diabetic retinopathy and glaucoma, macular degeneration, brain mass, diabetes. So all of these things, we always say that the eyes are the windows to the soul. And for us, we say it's also the windows to your health because our doctors can find everything. I mean, my doctor has found things that a normal primary care doctor missed, and we found it and saved many, many patients' lives just by seeing that dilated eye exam. So when you get dilated, it's not because we're being mean. Well, I am, but we really want to see inside that eye and make sure that you are as healthy as you possibly can be.
So thank you for that really great description. As a student who might have an interest in this field, what path would they have to take in order to do this? Do they have to do science, or can they be trained on the job? Do they have to go to college? What are their options? Because that's what we're all about today.
Great. That's an awesome question. Fortunately, I was able to go the route of starting out as a front desk receptionist, the high school graduate. And then I got trained and I worked under the doctor. And then I was able to get my certification under the doctor. So that is nice. And that is still possible in some parts of the country. There's also, I do believe there's a 2-year program that you would actually come out one level higher than me, which would be a COT of testing. So you could do, you're kind of lucky you have a fork in the road. You can either go, which you're on the floor learning under the doctor's license that taking care of with the doctor, or you can go to school and get your certificate and go that route. So ophthalmic technician is kind of a unique situation. We're kind of a hybrid. We're kind of half nurse, half technician, half counselor. So yes.
So with your certification, did the office pay for it, or did you have to pay for it? How did that work?
On my particular case, I paid for all of my certifications and stuff, but you have to work underneath the doctor, and he or she, would sign off, and then I would go to take our testing and stuff. But yes, I paid for all of my continuing education. We have to continue our credits and we have to keep our license up. But that's some offices, some universities. I work for a university, so it's a little different. Some are private practice, which they pay for everything. But yes, I mean, I pay for all of my standalone, and it is, my certification is technically worldwide. I can go work in a different country if I wanted to. It is recognized. I might have to take a supplement test, but I could travel and be a traveling ophthalmologic technician if I so wanted to.
So everyone who's listening, there will be information in the block about the career path, and that way you'll be able to learn more about that information. Thank you so much for being on, sharing your career, and just letting everyone know that this is one of many options that they have.
Yes, it is. Yay, thank you.
Thank you. All right, one moment. Thank you.